Well, a legacy certainly continued today as hundreds gathered for the Rosalynn Carter Mental Health Forum at the Carter Center, the first since Georgia's former First Lady died in November.
As Christy Diaz reports, it honored a pioneer of the mental health movement and highlighted how much work is still left to do.
8 years ago, Mrs. Carter founded this forum to bring together a diverse group of people to have a candid conversation about mental health. Today, the room was filled with everyone from lived experience to the First Lady of Georgia to talk about what the state is doing right and what still needs to improve.
Even in her absence, the conversation continued as if Mrs. Rosalynn Carter were still in the room.
I've worked on mental health issues since my husband was governor of Georgia.
The forum this year focused on parity, meaning equal coverage for physical and mental health. Eve Bird, director of the Carter Center's mental health program, says even though it's the law of the land, it's not always happening.
Sounds like a gap, like there's a law, but is it actually happening in reality?
We still have a long way to go.
Bird says an unprecedented number of people registered to attend this year, the first since Mrs. Carter's death.
She would be thrilled that so many people are making this a priority. So we hope that a larger group, a more diverse group, not the same old mental health community, become engaged in this.
Panels included leaders from agencies across the state, including Ser Familia, 2 Metro Atlanta HBCUs, and the Department of Veterans Services. First Lady of Georgia, Marty Kemp, and Commissioner Kevin Tanner, with the Department of Behavioral Health and Developmental Disabilities, gave an update on the rollout of 988, the state's new text or call suicide and crisis line.
Currently in Georgia, we're seeing around 20,000 calls per month to the 988 crisis line.
Right now, the crisis line responds based on the area code of someone's phone number. But with so many people moving to Georgia, Tanner says that doesn't always reflect someone's true location. So his department and the Carter Center recently sent a letter to the FCC asking for improvements so a caller will be connected to a local provider. A forum marking both how far we've come and how far mental health care still has to go. In Atlanta, Christy Diaz, 11 Alive News.